All right. Hi, everyone. Welcome. My name is Andrew Phillip, Senior Director for Clinical and Population Health here at the Primary Care Development Corporation. And I'm excited to have you join us for today's expert conversation where, as we often do, we're talking about integrated care, we're talking primary care, behavioral health, but also today we're going to be highlighting something that I think is near and dear to many of our hearts, or at least our evenings. And I'm particularly excited to introduce our guest for today, Alicia Kirley. Alicia is the Senior Director for Integrated Health at the National Council for Behavioral Health. Hi, Alicia. It's good to see you.
Hi, Andrew.
It's exciting to sit down with you and have the opportunity to really catch up and have this conversation. I've certainly been looking forward to it. And not only because, I definitely want to talk about some upcoming events that we've got going on, but also just to really, I think we're all interested in learning about the bird's eye view that you have of the field through your work with the center. And for those of us who aren't yet familiar, that's the SAMHSA Center for Integrated Health Solutions. So maybe you could tell us a little bit about what that is and also what are the things that you're excited about right now?
Yeah, great. Thanks, Andrew. I'd love to share more about the Center of Excellence, or as we refer to it as the COE, and some of the things that we're really excited about this year. Just for a little context and background, the COE is a National Training and Technical Assistance Center, as Andrew mentioned, funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, and run through the National Council. And the National Council has really been a leader in integrated care for over the last 10 years. And so we've recently launched this center to really intentionally address some of the immediate needs of the integrated care field, as well as looking at long-term implementation and sustainability strategies. After reaching 20,000 individuals since our launch last fall, we're really committed to supporting a variety of healthcare providers from all across the spectrum of integrated care, and really focusing on advancing the connection between behavioral health and substance use and physical health, really in all settings. And so the exciting thing about the work that we get to do is that integrated care looks different in every healthcare organization. And so that means that we're always building new trainings and resources focused on different integrated care settings or models or population needs. And this really ranges from primary care and behavioral health settings to school-based settings, as well as dentistry. So we also work really closely with individual providers and organizations. And so we're always up for learning more about how integration looks within each community and organization and really helping those folks to advance their models.
Oh, incredible. I love it. So yeah, integrated care, I think it's kind of where it's at right now, but it's also, it's been growing in popularity, I think for, more than 20 years now. But I think the COE is really unique in that this has been, a home when for a long time there really wasn't a clear home, especially for free, accessible information at the national level. And I know, so this year in Primary Care Development Corporation's work with the COE, we're focusing all of our kind of waking energy on sleep. And I have to admit, I was like a little bit, I don't know if nervous is the right word, but concerned, just in talking about the idea and proposing it because, sleep isn't like always considered the hottest topic. But, we do think it's important. And maybe you could talk a little bit about, why is sleep important for the center's audiences in particular?
Yeah, so sleep deprivation is something that really anyone and every healthcare provider can relate to. As we know, sleep impacts overall health, and that includes our physical and mental and behavioral health, and it can really drastically impact our health long term. And so some of those consequences that we know about are cardiovascular disease, hypertension, diabetes, just to name a few. And so not only can sleep disorders be symptoms of other health issues, but they can also be risk factors for mental health and substance use disorders. And that's why addressing sleep issues can be such a great target area for integrated care teams when they're really trying to help address the overall health of their client and their well-being of their patients.
Yeah, no, that makes so much sense. And I love that you're mentioning, the role of the teams and all this. And, it's clear sleep really does. It impacts almost everything, it seems like. It's medical, like you said, it's behavioral, it's social, and it's just really applicable right now. So, from that kind of bird's eye view, you work with thousands of organizations and individuals across the country. Like, what are the audiences themselves actually seeing around sleep that you've been hearing about?
Yeah, I would say the heightened psychological distress caused by the current pandemic has really shed a lot of light on the topic of sleep, sort of brought popularity about it, because healthy sleep is really directly linked to stress. the severity of it, the length of it, and so on. And so, as we all know, a lot of our previously normal routines, including our sleep routines, have really been uprooted because of the pandemic and things like needing to socially distance. And this disruption in sleep patterns can really have profound health effects, as we mentioned before. As you said, the center gets to hear from all different providers throughout the healthcare field, not just behavioral health providers. And so it's not surprising to hear from many of them that they're seeing increased sleep issues among the patients that they're seeing recently. They're really on the lookout for symptoms such as sleep pattern changes and sleep difficulty. And as we know, these disruptions to our normal routines, including sleep, has really affected all of us, but it's very different in terms of degree of severity for each of us.
Yeah, and I think that point, talking about, yes, sleep is something that hits home for all of us, certainly myself included, but it's different, right? There's some of us who it's hitting more. And, I think, that's where the points you brought up, everything going on now with COVID, but and it's also things that we've been talking about, like race, it's zip codes, it's where you're from, it's the conditions that you're born into and that you live in. And, we've seen real disparities there, and, unfortunately, including in the impact of sleep. And so, I think that's definitely a focus that absolutely we're going to keep, and we have to, and, I'm glad we're talking about it. So, so this is exciting, and just so folks know, so this fall we are kicking off this year-long virtual series on sleep with the center, the COE, and, we're going to be covering a whole range of topics. We'll be talking about how do you approach sleep as a healthcare provider from a true, like a biopsychosocial, holistic perspective. We'll be covering stuff like sleep medications. We'll talk about behavioral interventions, some of which are the gold standard interventions in all of medicine for sleep. We'll talk about those medical conditions that we know have a big interface, things like obstructive sleep apnea, for example. We'll also, again, we're going to really weave throughout that focus on how sleep interfaces in complex ways with social determinants, with health disparities. And, we're not only featuring folks from PCDC and from National Council and the COE, but also a host of other guests. And I think that's going to be really exciting. So we've got, clinicians, researchers. I think we're going to have some folks joining us from the National Sleep Foundation, sleep physicians, and of course, really core to this, people with lived experience. So, and the last thing that I just want to mention, we're going to talk about sort of the one group that I think gets talked about even less, which is us, like the healthcare providers. So we're going to pull back the covers a little bit on our own sleep issues and needs, and I think that's going to be pretty interesting too.
Yeah, this is really going to be a great in-depth series, especially from the integrated care perspective, as you mentioned, Andrew. And I'll just mention, as you were sort of talking, a lot of the work that we're going to be focusing on for this series is really interwoven to the other initiatives in the COE. Besides the sleep-specific series, we're focused on team-based care and population health management, health and racial equity gaps, behavioral health in other settings, as well as those ongoing COVID-related topics and impacts and supporting our providers. So it really does fit in well with the center initiatives for this year.
Yeah, it's exciting to see this build. And, we just came off last year, in our work with the center, just completed a year focused on diabetes, and that focus on integrated care and the role of different folks on the team and outside of the team really became evident. Awesome. Okay, so folks can head to our website, pcdc.org/sleep, as well as the COE's website for more information to check out our series and check out, new resources throughout the year on sleep. But I think they can also head over to National Council, right?
Yeah, they can check out our website at thenationalcouncil.org/integrated-health-COE. As Andrew mentioned, the Center of Excellence provides free resources, and so there's a ton of ongoing resources that are available through that website, as well as just accessing the National Council's website.
Okay, awesome. Well, great. So thanks again for taking the time to chat with us for a few minutes today. We'll definitely keep in touch as the year moves ahead. I'd encourage everyone to check out the COE's activities for the year. Also, the archives have great information that I think everyone in the field has been to at some point in time. And we'll definitely stay up to date and not sleep on the sleep series. Thanks, Alicia.
Yeah, great. Thanks so much, Andrew. Really looking forward to it.